According to the American Urological Association, normal total testosterone levels in men is anything above 300 nanograms per deciliter. But I believe this figure is on the low side. Testosterone levels have dropped since the 1980s, with average levels declining about 1% per year, and with that, a new normal has formed. In other words, if you go to your doctor, are healthy in every other way, get a testosterone level done, and it's 305, your doctor will mark it as normal and nothing will happen. However, if you look at this graph from a population study of men across various points in time, a testosterone of 305 would be counted as extremely low. The lower level of testosterone in men is a big problem, and scientists seem to have no idea why this is happening. But that's because there may be a handful of culprits and not just one. But before we get into those, we've got to understand the testosterone blood test and what it all means. And before jumping in and only focusing on T, we've got to understand other components of the blood test. Like all my other content, this is a purely educational video and should not be taken as medical advice. SHBG stands for 6-hormone binding globulin and is a protein made and secreted by the liver into the blood, where it binds sex steroids and regulates their bioavailability. Testosterone binds very strongly to SHBG and weakly to other proteins. Only 1% to 4% of circulating testosterone is unbound or free, and we think that only the free testosterone fraction is able to diffuse into the cell and exert a biological effect. If you want bioavailable testosterone, you don't want it bound to SHBG. So it's natural to think lower levels of SHBG is better, but actually timing is essential. See, both testosterone and SHBG spike during exercise and then return to baseline. So shorter term higher SHBG and testosterone levels after exercise are normal. It's a chronically raised SHBG that you don't want. Higher baseline SHBG levels are positively associated with age, total testosterone, anorexia nervosa, and hypothyroidism. If you're a man, a high SHBG and a low free testosterone also can cause sexual dysfunction. Elevated levels of SHBG and low free testosterone levels long term has also been significantly and independently associated with all-cause mortality. This highlights the importance of repeating blood tests. Never look at SHBG independently, and always its association with total and free testosterone. So a low SHBG level is a good thing. Once again, timing is important. Long-term low SHBG is positively associated with abdominal fat mass, triglyceride levels, and estradiol. More precisely, emerging evidence now shows that liver fat content rather than BMI is a strong determinant of low circulating SHBG. Low plasma SHBG levels are also predictive of a higher risk for developing metabolic syndrome, type 2 diabetes, and cardiovascular disease. Inflammation can also reduce SHBG levels. A reduction in SHBG is also seen in response to eating fructose or glucose. If you've got a low SHBG level, how can you normalize it? Firstly, rule out metabolic syndrome and/or non-alcoholic fatty liver disease, as well as hypothyroidism. And then you might want to lift weights, run, and use olive oil. They've all shown to help scientifically. Okay, next is the free androgen index. The free androgen index is a measure of the biologically available testosterone in the blood, and it's the ratio between the total testosterone and the level of SHBG. Because some labs don't measure unbound testosterone, the free androgen index is used as an indirect measure of this. In men, however, the free androgen index has been shown to correlate poorly with the free testosterone level and has been shown to overestimate the free testosterone level at low SHBG concentrations. Next is free testosterone. You can indirectly calculate circulating non-SHBG bound testosterone by taking 1% to 4% of your circulating testosterone number. Everyone wants to avoid low testosterone numbers, but if you aren't taking anabolic steroids or doing a workout just before your blood test, and you find that your results are very high, then I'd recommend repeating this test and visiting a doctor if it's still high, just to rule out testicular or adrenal tumours. It looks like as this trend continues, lower levels of T will become more and more normalized within the population. However, if you're interested in increasing your T naturally, then it's important to understand your blood work first. I hope you found this video useful. In men, circulating non-SHBG bound testosterone levels have been shown to be more strongly associated with muscle strength, bone mineral density, and bone quality, as well as fat mass, than total testosterone levels. Lower unbound T in men is also linked with depression and sexual dysfunction.